We are at the end of day 3 of COMy, and again, it has been a very busy day. I will not go through all the details, but day 3 was dedicated to the hot debates. And we had another debate about whether we should use now routinely MRD to guide therapy. I will not go back to this discussion because I summarized it as part of day 2. However, we had another hot debate about whether we should already replace auto-transplant with immune therapies. And this is fascinating because, of course, we don't have yet the evidence-based data, and most of the planned trials didn't even start. But the community is also already moving forward and looking into the future. And indeed, one may question whether at the era of bispecific antibodies, at the era of CAR T cells, where we know they are highly efficient and the safety profile is looking very good, whether you still need the old-fashioned, I would say, alkylating, high-dose alkylating agent to treat the patient. And obviously today, nobody has a right or wrong answer. I think there are data looking into the genomic of myeloma, and the number of mutations is definitely increasing after high-dose chemotherapy. That was presented by Dr. Munshi. However, it doesn't look like that this is impacting the outcome of patient at time of relapse. On the other hand, the immune therapies, and we know the power of immune therapy to treat cancer in general, are really convincing. Of course, the biggest question, and I'm maybe part of this group, is whether we can combine the immune therapies and auto-transplant. Because I do believe that in order to cure the highest number of patients, we would probably need to join forces and put together all the available agents, whether these are small molecules, the classical families, proteasome inhibitors, IMiDs, antibodies, the anti-CD38 antibodies especially, but also the classical high-dose chemotherapy plus the immune therapies. And this is about defining the comprehensive optimal package that will allow a patient to achieve cure. And actually, we already see, if you look carefully into the clinical trial databases, we do have such trials. So the next 5 to 10 years in myeloma are going to be really fascinating.